The COVID-19 pandemic has undoubtedly increased stress on the Zambian healthcare system. Healthcare workers are already short-staffed, and the burden of more patients causes stress on the health delivery system. With support from cooperating partners, government has recruited short-term health workers in its response to COVID-19.
Let me take this opportunity to appreciate the support from strategic institutions in terms of increasing the number of healthcare workers countrywide. Today, we applaud the World Bank, who have so far supported government in recruiting 573 healthcare workers on a short-term basis as we respond to COVID-19. We recognize CIDA's Centers for Infectious Disease Research in Zambia for supporting with 465 healthcare workers. The World Health Organization has brought on board 264 healthcare personnel. Some of these are undergoing training as we are speaking. And the bank, Zanaco, 52 healthcare workers. The Catholic Medical Mission Board, CMMB, 15 healthcare workers. So you can see this form of solidarity from institutions who traditionally are not involved in human resource management, but they've come to support the fight against COVID-19.
Permanent Secretary in the Ministry of Health, Kennedy Malama, says the support will provide relief to health workers.
What does this support do to our response? Number one, it will give some relief to our healthcare workers who have been working for the past 16 months in COVID treatment centers, a very challenging environment. Number two, it is also going to help us improve service delivery. As we've said, we're not only fighting COVID-19, but we need to ensure that other health programs continue running. So we are indebted to these institutions I've mentioned, and we call upon other strategic institutions who may have capacity to join the fight.
Meanwhile, the country has continued to see a reduction in COVID-19 cases and hospitalizations. However, Ministry of Health Director for Infectious Diseases, Professor Lloyd Mulenga, says he is concerned that 15% of patients admitted are in critical condition and that people continue going to health facilities very late.
We've also been seeing cases from all over the country presenting with saturations which are very low. One thing which we need to emphasize is that if someone has saturations which are below 60, when they come to the health facilities, even when we put them on various medications, we put them on high flow oxygen, we are going to see that the first day to 5 days, the oxygen saturations are going to be okay. But by that time, a lot of damage has been done to the lungs, such that even when you're pushing such a patient, even a month after, you find that the lung is consolidated, the lung is full of fluid, even the oxygen now starts failing to go into the lungs. So our emphasis is people that are feeling unwell to report early before the situation goes bad, because even when they start feeling better, because of the permanent damage which has been done, it becomes very difficult to reverse them.
In the last 24 hours, 34 new COVID-19 deaths were recorded throughout the country.
We currently have 9,116 out of 689 who are admitted. And when you look at this number, you see that 72% of them are on oxygen, which is 496. They are very, very sick people in our facilities. And normally when we report the death the following day, most of them are coming from this group of critically ill patients.
Virginia Chilongo, Movie TV News, Lusaka.